that one mechanism by which thickening occurs inside the blood vessels in all diabetes, which is now very well proved by science, is that there is an excessive deposition of cholesterol, bad cholesterol in the inner lining. And that does not correspond with the laboratory report. That means you can have an excellent lipid report profile. Your cholesterol total could be 150, 160, which is good, decent. Your LDL could be 100, which is the bad cholesterol, which is decent. But a diabetic's 100 LDL cholesterol and a non-diabetic's LDL cholesterol will behave very differently. A diabetic will have that blood cholesterol of LDL of 100, which has that peculiar tendency of getting into the vessel wall. That's called oxidized LDL. It gets into the vessel wall. Whereas a non-diabetic, not everything gets inside the vessel wall, it just flows through. You understand this? So the current recommendation, all diabetics above the age of 40 years should be necessarily on a cholesterol lowering medication. That's called statin. At the lowest dose, 10 milligram. Why? If you do that, you can prevent heart disease. You can prevent strokes also. Stroke has the same mechanism as heart attacks, blockage of the blood vessels. So please, if you are a diabetic or someone is diabetic, tell them this. It's important to take the cholesterol lowering medication irrespective of the LDL cholesterol which you get on your report, total cholesterol which you get on your report. That's the prevention against heart disease. High blood pressure accompanies diabetes in 70% of patients. So 7 out of 10 will have BP along with, you must treat it. Eye disease, very, very important. Diabetic retinopathy is our worry, naturally. And if you look at, I don't know our statistics, but let me quote what the kidney, it's called as the KDIGO data is. The KDIGO says that if you see 100 patients on dialysis, 76, got a huge number, 76 of those kidney failures are entirely because of diabetes. And kidney failure completely occurs because the sugar goes high, nothing else. That's not linked with cholesterol to a large extent. It's mainly the sugars. So what are we saying? If the sugars are well controlled, two things don't occur. Eyes are completely okay. Kidneys will never fail. No dialysis unit will function if diabetics are very well controlled. 76 out of 100. Fats, cholesterols in diabetes decides two events: strokes, heart attacks. Sugar, kidney and retina, eyes, fats, strokes, heart attacks. Lot of dental diseases, you are aware. Dental infections are extremely common. Nerve disease, in our hospital we have all these facilities to check your diabetic feet, to check the nerves, and you must look at it. Why? Because diabetics, the nerves getting affected lose the sensation. They are unable to perceive what's going on. So when they walk on a stone or if something hurts them on their feet on the road, they won't be able to recognize it. Causes a small ulcer. The ulcer goes on becoming bigger and bigger. And then it's a problem, right? You have to dress it up, do all sorts of things, and try and see what. This is called as diabetic foot. It's typically called as diabetic foot. Diabetic foot, normal foot, diabetic foot. Diabetic foot, you take care. Again, this is very sensitive to sugar. You keep the sugar down, this doesn't occur. Otherwise, these ulcers occur. And if these ulcers occur, one or other day, patients have to undergo amputations, removal of the toes and legs. I told you about the 3 months average sugar. Extremely important. Let me skip all this. And you can come and do it every 3 months. Every 3 months. Why? Because this doesn't depend upon what you've eaten or not eaten on that particular day. A lot of people have this fancy in their mind. Yesterday I ate rasgulla, so today my sugar is high. Today I did not go for a walk because it was cold outside, though I do not know what is cold in Mumbai. But 12 degrees is cold, 18 degrees is cold, 20 degrees is cold. People just don't want to exercise. So every time they say, नहीं सर विंटर था ना अभी 1 महीने से एक्सरसाइज बंद है. हाँ अभी सर समर है ना इतना धूप हो जाता है, उठते हैं तब तक तो धूप हो जाता है, इतना बारिश है कहाँ जाएंगे, गिर जाएंगे, रास्ते में खड्डे करके रखे म्यूनसिपालिटी ने. So we always have excuse for everything, right? So that doesn't work. Okay. Another is glucose monitoring, blood glucose monitoring by your glucometer. Labs are very reliable. And patients always say that the glucometers are erratic. My glucometer shows this reading. They say मेरे ग्लूकोमीटर में रीडिंग है 100 है, आपका लैब में रीडिंग है 140, लैब में गड़बड़ किया है. Or our readings are 140, labs reading 100. So let me explain this way. Labs take blood from here, venous sample. So your veins bringing the impure blood, arteries taking out the pure blood, and there is a connection in between called as the capillaries, small twigs which connect the arteries and the vein. Those small twigs are here. So when you puncture, you take the capillary blood, it will be a little more, particularly in the post-lunch phase. So your glucometer reading post-lunch at home may be about 15, 20 milligram higher than the lab readings. These days, glucometers have got standardized. That's called as a plasma equivalent. So when your plasma equivalent, all levels are okay. It's not a problem. So glucometers are reliable. Please use them at home so that you know, particularly those who are taking insulins or frequent doses should use it. There are other ways. There is a continuous glucose monitoring device by Medtronic. You can put it here, goes on monitoring all times. Artificial pancreas is still a little dream for us because very expensive, difficult to implant. We have sultry weather, the sweats are more, the superficial skin infections are more, but we have patients who are on artificial implanted pancreas. Okay. Diet, I think dietitian spoke to you about everything that you should eat in the diet. Everything in moderation is okay. Everything is sugar, please understand that. Don't get into this concept. If you eat rice, you have sugar, and if you eat chapatis, you don't have sugar, and you can't eat rice, can't eat this, can't eat that. Here is the point. You don't need extra sugar in diet, cut it off. Even if you are not a diabetic today, your father or mother who is diabetic, remove the sugar from your tea, please. Don't purchase sugar beverages. Don't purchase sweetened sugar things. If you're hungry, eat a sandwich. Don't eat samosas. Don't eat vada pavs. Keep away from them. It's not going to help you in any other way. No extra sugar. And no extra salt also. See, the human system does not require extra salt. It doesn't require extra sugar. There are no benefits at all. There are zero benefits. Whatever you consume in whatever you make, that's enough. And that should be in moderation. When you eat chapatis, it's sugar. When you eat rice, it's in sugar. But you have to look at the glycemic index of the food. Glycemic index means it should be equivalent to the bread that is consumed and gets converted into sugar. So if you have a certain amount of sugar coming from a food product, that's fine. Let's say, people say basmati is bad, but basmati has a low glycemic index. That's okay. Brown sugar is good. Brown rice is good. Probably yes, glycemic index is lesser. Tukda rice, depending upon what rice you are consuming, can have a very high glycemic index or a very low glycemic index. So it all goes by the science of diet. It doesn't necessarily go by what specifically. We can talk about that. Please eat some nuts a day. Walnuts, almonds are very good. For the poor man, groundnuts are also very good. Have a handful of nuts daily. It contains what is called as monounsaturated fatty acid MUFA that doesn't allow your bad cholesterol to go up. So healthy eating, right size. The pyramid has gone a little up and down now. The old pyramid has been reversed. So now we say take more salads, take more vegetables, take more nuts. You see all this, and have a balance in diet. If you're non-vegetarian, take fish. It's very, very good. If you can eat the freshwater fish, still better than eating the saltwater fish because the MUFA content is excellent. But then don't get into habit of frying everything. Everything that's fried, and fish is particularly gone the moment it's fried. There's nothing left. The oils get completely denatured. Okay, and simple things for diabetics, you can have a carb serving. Take a dairy product daily, please, because there is a huge belief now that Indians get a lot of diabetes because our protein content in diet is very, very low. And because you eat less proteins, because of all our thoughts, we say dairy products are not good, curds are not, milk you can't have, curds you can't have. That's unwise to say because then you will eat a lot of carbohydrates, and that's unfair. See, we cannot build upon carbohydrates by losing on that. And physical activity, I already talked to you about. It has a lot of advantages, gives you a quality of life, makes you feel better. Right? I'm going to stop here. So 30 minutes of moderate activity on most days are recommended. Now, there is a huge chapter on insulin, which I'm quitting. Here is what you need to understand primarily. Once you are a diabetic, you cannot prevent it all the time. Once you are a diabetic, once you are on medications, uh, all medications principally work only on one principle. If your body is generating insulin, it will make it secrete a little more insulin. Whatever insulin is being secreted in your system, it will make it more effective. If you don't produce insulin, you can take n number of medicines, it's not going to work. Very, very simple. Your pancreas don't generate insulin, you need insulin. That's the bottom line. All right? Let me thank you at this point of time. If there are any questions, I'll take it. And sorry if I exceeded time.
Is there any questions for sir from the audience?
Yes, sir.
Sir, normally in market nowadays, sugar-free has come.
Yes.
Really, is it advisable to take?
Oh, yes, yes, yes. There is a
How does it?
specified, oh yeah, there is a specified quantity. There is a recommended quantity which can be taken daily. By and large, you require it on a day basis in your cup of tea or coffee. That's all you eat normally day to day as a sweetener. Sometimes in your sweet dish you can use it. Sometimes. That's also perfectly okay. Day to day basis you take it 4 or 6 pills in your tea or coffee. That's completely okay. No problem. There is no cancer. There are no major side effects. But there is a recommended dose. And in India we never exceed it. So please don't worry about it. Absolutely okay.
Sir, my name is Manoj Singh. You talked about reducing therapy of that cholesterol level, okay, after the age of 40. So is there any side effect for that or?
Of the cholesterol lowering medication?
Yeah.
Yes, there are. There are side effects once you exceed a certain dose, which is required in most of the patient afterwards. When you exceed 40 milligrams and beyond, we are talking of 10, which is primary dose. 40 and beyond can lead to muscle pains, little liver toxicity, sometimes in very elderly people, little forgetfulness. These are known side effects. Worry is mainly muscle pains or myopathy. And therefore we are saying, if you don't have a heart attack, you take 10 milligrams, you can prevent heart attack. Once you get a heart attack, you take 80 milligrams lifelong. You get muscle pains, well, you have it. You will have to bear with it. There's nothing else we can do. So, side effects are there. Benefits, 10 milligram is very, very safe because cholesterol lowering drugs was introduced in 1993, first trial. Now we are, 23 years away. 23 years is good enough experience for any medicine.
Okay, thank you.
Yeah.
Sir, any side effects if we take regularly metformin tablets?
Not really. It's the safest, the most safe medication ever produced in the field of diabetes. Very, very safe. Up to 2 grams, 2000 milligrams per day. One contraindication, one exception is patients having kidney disease should not be on metformin. Patients who have a kidney disease should not be on metformin. हाँ बोला.
आपण जे रक्त काढून 2 तासांनी जी टेस्ट करतो
हो.
आणि ह्या मशीननी टेस्ट करतो
हां.
तर त्याच्यात फरक आहे का म्हणजे
हो
भरपूर?
मी सांगितलं ना 15 ते 20 मिलीग्राम डेसिलिटरचा फरक पडू शकतो. जास्त येऊ शकतं याच्यात कॅपिलरीमध्ये ग्लुकोमीटरमध्ये. पण जे नवीन ग्लुकोमीटर आहेत सध्याचे त्याच्यात हा डिफरन्स काढून टाकण्यात आलेला आहे. त्याला प्लास्मा इक्विव्हॅलंट म्हणतात. तो डिफरन्स त्यांनी सॉर्ट आउट केलेला आहे. ऑटोमॅटेड झालेला आहे ते. त्यामुळे ग्लुकोमीटर यूज करू शकता तुम्ही. हरकत नाही आहे काही.
पण नाहीतर मग वर्षातून किती 2दा किंवा 3दा केली पाहिजे का?
म्हणजे ज्यांना डायबिटीस आहे त्यांना
डायबिटीज आहे
हां.
पण ती वर्षातनं 3दा 4दा केली पाहिजे का 2दा?
प्रत्येक डायबिटीस रुग्णांनी 3-3 महिन्यांनी त्याच्या डायबिटॉलॉजिस्टना दाखवणं गरजेचं आहे. डॉक्टरांना 3 महिन्यांनी दाखवा. रेग्युलर चेकअप 3 महिन्यांनी ठेवा. डॉक्टर म्हणतील तो प्रोटोकॉल फॉलो करून ती शुगर चेक करत राहा. इन्सुलिनवर असेल घरी ग्लुकोमीटरनी चेक करत राहा.
Good morning, sir.
Hello,
After such an excellent lecture, it really leaves us with any questions. Sir, I have read a lot of literature on fatty liver.
That's right.
But I really wanted to ask you from your own clinical experience, once a person gets fatty liver, is it reversible or not?
The earlier phase, later on, a entity develops called as NASH.
Yeah.
Once it gets into steatohepatosis, that's the time only diet and exercise possibly cannot reverse it because there is already onset of liver fibrosis. So that's the time you require some medications. And a small percentage of that NASH can further progresses into a cirrhotic liver. So by itself it can be potentially dangerous, and one should not neglect it at the early phase itself.
So by early phase, do you mean grade 1?
Yeah, grade 1. That's reversible
Yeah. And does vitamin E capsule Avion
to
has
some
got
extent.
any role to
To some extent. Even the cholesterol lowering medication also helps to some extent.
Okay, but dieting and exercise will help your greater
Top of the
extent.
order for NASH.
Okay. And sir, my second question would be, what about cornflakes with milk for breakfast? Is it advisable or not advisable?
I mean, corn itself will put in a little extra carbs.
Yes, sir.
So one can use wheat flakes
Okay.
instead.
Yeah.
Or you can use a mix of oats
Oats also.
and wheat.
Okay.
Put in a little raisins or whatever recommended dry nuts. So create a muesli. So that becomes much more better than just eating cornflakes with milk, because that may increase your sugar.
Okay. Thank you, sir. Thank you, sir. Come.
Hello. XMAT SR 1G twice daily. Any side effects?
Sorry?
XMAT SR 1G twice daily.
What is that? Expert?
XMAT SR.
Exmet SR is metformin.
Yeah.
Yeah, no. I said already, it's a very, very safe and good drug. Twice daily, no problem.
Okay.
Absolutely no problem.
So we are speaking of lot of alternative medicine in
Yes.
that,
Yes.
particularly the herbal preparations.
Absolutely.
and all. How do you put them in?
No, they have a very important role to play. The point is they should be defined herbal medicines. It doesn't go by hearsay, by quack practice, by purchasing it from pharmacy shops because the pharmacist gives you, इससे diabetes कम हो जाता है आपका. That's not fair. One message. Second message is it should not contain any toxic metals in, in the name of Ayurveda. There should not be any heavy metals. And three, and very, very, very important, some of these are what we call as insulinopenic herbal medicine. So what they do is, quickly they will act on the pancreas and make your insulin secretion very fast. Now, if you are on medications for diabetes, which also does the same thing, like a medicine called glimepiride, which makes your pancreas secrete insulin, the herbal medicine, insulinopenic Ayurvedic medicine, also makes your pancreas secrete a lot of insulin. When all this comes together, sugar can really, really drop. So that can be alarming. You can get a lot of people getting into very, very low sugar problems suddenly. So you have to be careful. But generally, a good alternative medicine will come with a lifestyle. They will explain you how it all goes, not just taking a pack of medicines or pills.
सर मी ब्लड थिनर घेतो
हो.
लोप्रिन 75.
बरोबर आहे.
तर त्याच्यामुळे माझ्या युरिनमध्ये ब्लड येतं
शक्य आहे.
+2 +3 असं.
बरोबर आहे.
तर समजा मी अर्धी गोळी घेतली तर एक काय गोळी आहे?
फार फरक पडत नाही, कारण का रक्त पातळीचं लेवल 30 मिलीग्राम ते 300 मिलीग्राम ह्या सगळ्या डोजला बघायला मिळतं. 30 मिलीग्रामची घेतली तरी होतं 300 रक्त पातळीचं जे त्याची इफेक्ट आहे ती. पण आता एक आणखीन गोष्ट, म्हणजे हा प्रश्न वैयक्तिक आहे थोडा, पण हा तुम्ही विचारला म्हणून सांगतोय की जर युरिनमध्ये ब्लड जात असेल तर प्रत्येक वेळेला ॲझ्युम करून पण योग्य नव्हे की हे फक्त ॲस्पिरिनमुळेच असेल. त्याच्यात इतर कारणं पण असू शकतात वयाप्रमाणे, प्रॉस्टेट ग्रंथीशी रिलेटेड, युरिन ब्लॅडरशी रिलेटेड, किडनी स्टोनशी रिलेटेड. तर व्यवस्थित सोनोग्राफी करून एक युरोलॉजिस्टनं कन्सल्ट करणं अगदी योग्य आहे, कारण का युरिनमध्ये ब्लड येणं या सिम्पटमचं खूप महत्त्व आहे. म्हणजे त्याला अगदी आपण ॲझ्युम करून नाही चालायचं की ॲस्प्रिनमुळेच असेल. इतर कारणं पण असू शकतात त्याची, एज रिलेटेड. 65 अँड अबाव देर आर अदर रिझन्स.
Thank you very much, Doctor.
थँक्यू.
So last 20 years I was having blood sugar, but it was 220, 250, 280 and all. But since last 3 years I am under Dr. Uday Jadhav. So now it is very controlled, and you have reduced my medicine also. It is Glipimide MB, Glipimide MB 1. It was MB2 earlier. Now it is very much under control. So I don't exercise also.
No. I did not tell you to do that. You please exercise daily. Yeah.
Is there anybody who would like to ask sir any queries?
Thank you.
Thank you, sir, for such an informative session. I would call upon Dr. I think there's one more, sir, there's one more query for you, sir.
Yes.
Sir, if we started taking medicine to relieve from diabetes, is it compulsory that we have to take for lifelong?
Diabetes is a metabolic disease, so it doesn't have a complete normalcy or reversibility. Therefore, there may be a little exception here and there, but this is more of anecdotes, where somebody goes completely back to normal without medication lifelong. By and large, you assume that it's a lifelong disease and you have to take medication.
And second question is there any difference? Suppose your fasting sugar is around 100 to 110 and after meal is 150 to 160.
Yeah.
Still, is there any difference? Suppose your this point get increase or it's...
You are talking of what difference it makes to the HB1AC? No, I did not get it.
This, suppose if I have check the diabetes and if it's 110 and 130, is there make any difference? Suppose after 2 hours the diabetes is 140 or sometimes if it's 180.
Generally, I said that already, the fasting is much more predictive and much more of utility than post-meal sugar.
And what about sometimes that we are getting some messages from on WhatsApp, suppose if you eat chutney of means anardana and garlic and 4 items to mix and that will cure the diabetes.
Okay, let's not forget our tradition. So these indigenous things in our day-to-day herbs and indigenous food products will have a specific importance and they will have some sort of advantages, but these are not exclusive. They are more of an add-on advantage and you can use it, but don't go get completely carried away with it because that may not be the answer.
Sir, if fatty acids plus and then having some kidney problems, like I have done the angioplasty